a fantastic job in just a short time.
She's the steady, experienced hand in this crisis.
And so we have been working on models day and night around the globe to really predict, because some countries in our very early stage, like the United States.
Dr. Deborah Birx, brought on by the vice president when he was put in charge of the coronavirus task force.
She has served in the uniform of the United States. She has served in multiple administrations, and she's going to be our right arm.
In a time of hyper-partisanship and division over the American response to COVID-19, Dr. Birx is that rare breed of someone universally respected on both sides of the aisle, as well as by the medical community.
I'm a big fan of the deputy that they just appointed, Deborah Bird. Colonel Birx has been running the PEPFAR program, the big AIDS program, for 3 previous administrations. She's first rate.
Birx is something of a legend in global health, making her name over 3 decades of fighting HIV/AIDS and developing vaccines. Dr. Anthony Fauci, who has become a leading voice for the administration in this crisis, has known Birx since the early 80s and gushed when she joined him on the task force.
She was actually a fellow in my program as a trainee, and we knew she was a star then. And now what has happened over the years, she's become a superstar.
Birx left the military after 20 years and joined the George W. Bush administration's AIDS relief program. She took over in 2014 when President Barack Obama named her an ambassador and global AIDS coordinator in John Kerry's State Department.
So for Debbie, the last thing I'll say to you all is that taking the fight to AIDS is not simply a career, it really is a calling.
Unlike other Obama officials, Birx was kept on by the Trump administration and has just moved from the State Department to the White House.
She will do an excellent job for the American people. We're proud to have her being part of that team.
After rising to the top of her field, Birx is now facing something no one has seen before, with the whole country and many around the world looking to her for wisdom and guidance.
We're at our best when the country comes together in a bipartisan way, and that has really been extraordinary to witness.
Now there's another story that's worth telling about Dr. Deborah Birx. In 1983, when she was giving birth to her eldest daughter, she suffered severe blood loss. And at the time, she had just read a report about an unknown deadly disease that made blood transfusions risky. A blood transfusion was called for by the hospital, but before Birx passed out from the pain, she screamed in the room, "Do not let them give me blood." So her husband turned down the transfusion, and it's a good thing he did, because the hospital later found out that the blood that she would have been given was contaminated by HIV. Now, that's a story that was told by Secretary Kerry when she was named as an ambassador in the Obama administration. AIDS, of course, was a disease that would come to define her career, perhaps, John, until now.